While COVID-19 unleashed its wrath on the world, it also brought out the best out of humanity. People banded together for the vulnerable. Soup kitchens and COVID gardens began springing up.
During the lockdown, it's very difficult. On our register, we have now 120, 130 children with elderly and youth that we provide with a daily meal each and every day. This garden has helped me a lot, and really I can see that sometimes we don't have money to buy some veggies, but we can use our own veggies to make food for the children and for the community.
Having overcome the virus, this couple is still trying to make sense of their new normal.
The
lockdown was stressful, especially for the children, but now it's a bit easier. They've learned to wear their masks. They understand that they have to social distance. It's not always easy because at school they have to, for an example, not to be close to each other. They were used to playing with balls. Now they can't do that anymore. So all those things they've learned during the pandemic, it's become part of their everyday life.
We have, because even walking down the road or meeting with family these days is a challenge, because if you walk down the road, you are required by law to wear a mask, and it's not always convenient to wear a mask. Visiting family can be a situation where you're not always sure whether it will be safe to visit your family.
With COVID numbers declining, healthcare workers are getting a bit of a break now.
The last 12 months has been an exceptionally challenging and at times very hard time for healthcare workers. In the garden route specifically, we were a hotspot, a very high burden area. We saw many cases, many ill people, and unfortunately, obviously also deaths. What was incredibly heartening during this period was to see how our staff came to the party, how they've gone beyond the call of duty, so to speak, many times sacrificing their time with their family and often also putting their own safety at risk dealing with infected patients.
With the second wave having taken its toll on this region, health authorities are now gearing up for the third wave. They say a key lesson is to pay attention to the early warning signs of an upswing in infections and mortality rates. Segri Chetty, SABC News, George in the Western Cape.